I just want to meet a president one day.
Nice. All right. Well, I hope you end up, playing golf with Barack Obama or something. That would be awesome. Cynthia Field.
Hi, good morning. I'm Cynthia Fields. I am a project coordinator with TLC for chronic care prevention and education. And I've been working with the organization just a few months now and enjoying it in my retirement. And I would like to, I think I just want to travel. I think I just want to be able to travel. And I don't have a particular spot right now. I'm just making a list and trying to check it off.
That's a great goal. Thanks, Cynthia. Daniel Paban.
Yes, Pabon. Good morning. Can you hear me?
Yeah.
Great. A couple of things I have heard that really tingle my mind. Dr. Carter, you mentioned the John Hopkins pediatric situation, and I have the honor of having Dr. Ben Carson and his wife at our table. They go to my church, and since she plays the violin and I play the piano, classical piano, so I met a great guy, great guy. Number two, I heard Vietnam. I'm a Vietnam veteran. And one of my things that I like to do is go back to Saigon and see what Saigon looks like now as when I was there back in 1970, 71. It's beautiful people, they're very kind. And I remember that as a soldier, they look at us, like careful. But they love the fact that when you go by them in the city of Saigon, you go this way, like this, and they love that. Means, I respect you, you respect me, and so on. And I work for HCDI, which is Healthcare Dynamics International, and I'm a liaison, a Hispanic, and I work at a clinic here. Actually, it's a help center working with Hispanics people since I speak Spanish fluently. So I love what I'm doing, and I've had the great supervisors. I have the best.
Awesome. Thank you so much, and thank you for your service.
Thank you, man. Appreciate that.
Absolutely. Dolores?
Hi, my name is Dolores, and I'm also a CHW that is employed by HCDI, Healthcare Dynamics International. Right now is stationed at Carmar Manor, and also considered the City Hall of Carmar Manor. One of my goals that I always wanted to do was to fly an airplane, a jet airplane. Yes, so that's something that I have always wanted to do. So, but besides that, everything else that I'm doing now, I really enjoy helping people also.
Wow, that's awesome. That's great. Thank you, Dolores. Liz?
Hi, everyone. I'm Liz Buchanan. I am a project manager for HCDI, and I'm also the facilitator of the CCCT. And something I've always wanted to do is go skydiving.
Ooh, that's a good one. Thanks, Liz. Jessica Gamero.
Hi, good morning. My name is Jessica Gamero. I am the program coordinator for MedStar Southern Maryland Hospital Center, the Community Health Department. And one thing that I've always wanted to do is learn American Sign Language.
Oh, that's a good one too. I'm gonna have to add so much to my bucket list now. Charlena Jones. Charlena, if you're there, we can't hear you. Right, Kelly Shaw.
Hi, I'm Kelly Shaw. I'm a community health worker with HCDI, and currently I help people at Joe Family Care. And one thing I've always wanted to do was go on a safari tour in Tanzania.
Thanks, Kelly. Leland Edwards. I think I saw you, but you disappeared. Are you there, Leland? Maybe she lost her connection. Margaret?
Hello, my name is Margaret Fowler and I work with Cindy Fields at TLC, and I'm glad to be part of this group. And um, my goal is probably a little boring but simple. I just want to live healthy as long as I live and continue to serve others and make beautiful memories with my family, wherever that takes me.
That's a good one. Thanks, Margaret. Maya Perrin.
Hello, everyone. My name is Maya. I work for HCDI. I'm a community health worker on the LEAP project. My goal, or kind of like, it's kind of cliche, but I just want to go swimming with the dolphins and take my daughter to go swimming with them.
That's great. Thanks, Maya. Nadira Smith.
Good morning. Good morning. My name is Nadira Smith. I am the Senior Director of Business Development for Win Family Health. I've been with my agency for 18 years and I love it here. But I would like to one day just live off the grid in a mountain in Ghana, away from civilization for a couple of years. So thank you.
Very cool. Naya Thomas.
Hi, my name is Nadia. I'm a community health worker with HCDI with the LEAP project, and something I always wanted to do is go on a food tour around the world.
That sounds fun.
Yeah,
Mike. Yes, thank you so much, Naja. Mike.
Yes, good morning. My name is Mike Zeni. I work for the health department and as a community health workers coordinator. Something I want to do is jump with a parachute. I did a paragliding, so I would like to try a parachute one day.
Wow, that's brave of you, Mike.
Thank you.
I will not be joining you. Thanks. Priscilla.
Hi, good morning. My name is Priscilla Thomas. I work with TLC with Margaret and Cindy. I'm project manager for TLC with my primary focus on engaging providers and our diabetes prevention and management programs. Have quite a few things on my bucket list. One is to learn to swim. So that's kind of high on my list. Travel to Hawaii, and I would like to coordinate that at a time where President Obama is there. Haven't been able to figure out how to do that yet, but that's on my list. And then the other thing is I've done the paragliding, just recently did a helicopter ride, and considering I'm afraid of heights, that was a huge accomplishment for me. So those are the things probably that are on the top of my bucket list.
Well, way to conquer your fears, Priscilla. Rachel.
Well, hi, I'm Rachel Smith, Chief Program Officer at HCDI. I see some familiar faces here. Nice to see you. Hi, Sharon. You know, I was trying to think of what I was on my list. I love traveling, and I'll go any place. I think Malta might be next on my bucket list, someplace I'd like to go. And Caitlin, I have some tips for you.
Oh, okay. Nice. I'm excited. Okay, Rosalind Young. I'm glad you got in. I'm sorry you're having trouble.
Yes, thank you. Good morning. My name is Rosalind, community health worker with University of Maryland, Charles Regional Medical Center. Sorry, I don't have a bucket list yet.
That's okay. Thank you for that. Scarlett Castro.
Hi, everyone. Good morning. My name is Scarlett Castro. I have my camera off because, as you can hear, I have my little infant with me today. I am a program assistant at the Institute of Public Health Innovation and the Prince George's Food Equity Council. I'm a recent mom, so I have a lot of aspirations professionally, but also now shifted into motherhood. And I guess one of my biggest things is hopefully one day I can have my family moved back to Belize, where I'm from, to kind of like teach my son my culture, to grow up. I grew up in an island, so when I was growing up, we walked barefoot in the sand, and I think that was like like now I have all those amazing childhood memories. So I hope I can pass them along to my son. Thank you. Nice to meet
Beautiful.
everyone.
Great to meet you too, and congratulations. Shirley.
Okay, you can't have me go after Scarlett like that. I'm like, oh, geez. So, good morning, everyone. I'm Shirley Schroepler, Acting Associate Director of Health and Wellness at the Health Department. I think my bucket list, wish list have changed as I've gotten older. You know, everybody was talking. The first thing I was thinking is like, what did I really want to like? I'd like to win the lottery. Like, let's just talk about it. But I was like, okay. But something that I always wanted to do, that I strive to do, I haven't yet accomplished it, but to be able to fill every page on my passport.
Ooh, that's a good one. Thanks,
And I
Shirley.
did get an opportunity to meet President Biden when he was vice president.
What? That's awesome. Sharon.
Hi, good morning. I'm Sharon Zalewski. I'm the Executive Director of the Regional Primary Care Coalition. I would like to travel more. I have accomplished a few things on my bucket list. Most recently, a trip to South Africa, which for all of those who want to travel and do safaris and things like that, I highly recommend it. But my best learning experiences in life have come from trips. Trips where I get to interact with people. I've been to Central America, and since many of our clients and patients are from Central America, it's just really eye-opening to see how people live in their own environments, and all the lessons I learn are applicable to pieces of work that I'm doing or have done here, and give me new perspective and insight.
That's awesome. Thank you, Sharon. Kim?
Hi, good morning, everyone. I'm Kim Stinchcomb. I am the Manager of Community Impact and Assessment with the Health Department. I manage the Healthcare Action Coalition, and my to-do list is to visit every habitable continent at least once.
Awesome. Tornisha?
Hello, everyone. I'm Twanisha Stokes, the project manager of the Prevention Link program with Prince George's County Health Department, and I just want to travel the world.
Thanks, Tornisha. John, so good to see you.
Hey, good morning, everyone. I go by Jay Summerlot. I work for the Prince George's County Department of Social Services. I am the Coordinated Entry Program Manager in the Prince George's County Homeless Continuum of Care, bringing greetings from the street outreach. I was just attending the weekly street outreach team meeting. So bringing greetings from the Homeless Services Continuum. I have been fortunate enough to travel quite a lot to Europe and South America and a lot of other places, but I've never visited our closest neighbors, which seems weird somehow. So I would like to go to both Mexico and Canada.
I think we should go on a group trip. Like, this is sounding awesome. Everybody
Yeah, I
wants
think
to
we have our
travel.
own tour trip here. Like,
Yes.
all we got to do is get our dates together.
Yes, that's our next one can be abroad. Chris, thank you, Jay. Crystal?
Hey, good morning. My name's Crystal Swim. I am a pediatric nurse, case manager, and the special needs coordinator for WellPoint. I'm on the travel boat with everybody else. As far as just wanting to go anywhere overseas, I haven't done that yet, so I'm looking forward to hopefully doing that in the future. Thank you.
Awesome. It looks like Leland, it looks like you're back. I don't know, we didn't hear you. If you wanted to, I don't know if you want to come off mute and introduce, or I'll skip you, no pressure. Okay, next we have Tara Pavao.
Pavo. Hi, Jay.
Pavos.
I came on camera when I saw Jay. Jay and I had worked on a project, I think maybe last year. But anywho, my name is Tara Pavo. I'm the director of social services at Mary Center, and oh my goodness, yeah, everyone had some really great goals, and I was just loving everybody's goals. But I do feel like a goal that I have that's been achievable, and I also want to share. I actually completed one of my bucket lists that I thought it was so amazing, but I had gone to Rome and attended, excuse me, and attended a mass led by the Pope. That had always been my bucket list. And let me tell you, when I would think it would be thousands of people, but when you're looking around and it's like, how is everyone going to, receive sacraments and stuff? And it was just amazing. But anywho, I would love to have a goal of growing my own fruits and vegetables. When someone mentioned a homestead, I was like, that's it. I mean, I've been doing so well with growing my plants and my roses and everything that I have and I love to garden. But I would love, love, love to be able to grow fruit and vegetables and herbs and those kinds of things that I just haven't ventured into yet. But I would love to learn more and do it one of these days.
Very cool. I love my garden, so I highly recommend. Tracy, I see you put in the chat, but I know you're not shy because you happen to be a TV star.
Hi. I want to blame that on this. Okay. Hi, everyone. My name is Tracy. I work for the CHWs project for ACDI. And I like what everyone said. Everyone had interesting bucket lists. And I can relate to Miss Priscilla because she was like, she has a little issues with heights, and I do too. So I was thinking about trying to break it off a little bit. I can do a little indoor skydiving because it sounds more safer to me. I don't know, but that's what I was thinking. But my ultimate goal for life, I would before I ever like leave this earth, I would like to like do research on how to stop the aging not stop the aging process, but to slow down the aging process. What do we need to do to stop the aging process? And how can we just bring back that life again? Like, you know what I'm saying? And so that would be something cool to look into, but that's it.
Yeah, that's awesome. That's a great goal. And I just saw Veronica, I just saw what you put in the chat. Yes, you're showing up as Leland for some reason. So that's thank you for putting your introduction in the chat. And anyone else, would you like to go if you were missed? Or you as well, Veronica, if you wanted to speak it.
Oh, thank you for noticing that. I kept trying to check why I was coming up as my colleague and I couldn't correct it. So I said, let me just put it in the chat.
That works.
Thank you.
All right, everyone. Well, typically I will not go through this full exercise in the future just because this is a very well-attended meeting. We have 32 people on. So, but I think this was a really fun exercise for our first meeting so we could see who was on and get to know each other a bit. So thank you for indulging my icebreaker. I have lots of things to add to my bucket list. All right, so getting into the meat of today, we want to make sure that everybody understands who should be at CCCT. So of course, everyone who is on the phone right now, I'm really excited. We have lots of different sectors represented. And this is really, your community of practice and the place where we can get together and do problem solving to identify gaps in care coordination and how to fix them. And I know there are a lot. So I'm glad that we're all here today. One thing that we found was very effective during the pandemic is whenever we would kind of come together around a certain topic, we would try to figure out among ourselves who is missing, like who else needs to be here that's not currently here. And through our connections that we had as individuals, we were able to get the right people to the table. So I want to make sure that you all know who we kind of envision as being part of CCCT. Of course, it's anyone who has any role in care coordination or just arranging care between two or more people focused on an individual patient and what they need in terms of their health care and public health services. So if you'll indulge our crazy diagram over here for a second, of course, that includes representation from primary care, specialty care, inpatient care like hospitals, hospital discharge coordinators, mental health services, long-term care facilities, your home care, informal caregivers like family or friends or other support patient advocacy organizations or support organizations, community resources. So we know there's lots of different programming that is great to include in care coordination, and then medications and pharmacy, and of course, our payers. So I know we have some individuals from insurance companies on today who are also critical members of care coordination. So thank you all so much for joining. And I'm trying to get your creative juices flowing, trying to figure out who else needs to be here who may not be on today. Next slide. So if you were in CCCT before, you might remember that it is very much a working meeting. There is no getting off the hook without doing a little bit of work. So I will give you all the next 5 minutes, if you would, to pull up this survey that Kim just put in the chat. Should I share it? Let me see. Hold on. Try to make sure Yeah, so if everybody could just take 5 minutes real quick and complete that survey. The questions are just your first and last name, your email address, your organization, the types of services your organization provides, the population that your organization serves. So that could be like youth, veterans, whoever it is you're trying to reach. At what point in the care continuum does your organization best work with residents? So that might be, right after they leave the hospital after an inpatient stay, or maybe when they're trying to re-enter the population after being incarcerated. Any special information like that. The different social determinants of health your organization might address, challenges you're facing, and then who else should be at CCCT who is not here right now. And we will compile this information and send this all back out to you. I think one thing that we saw in the past was a very useful part of CCCT is making those connections across different organizations. So I will be quiet now and give us that 5 minutes to complete that survey. So thank you guys.
All right. Thank you, everyone, for taking the time to complete this. And feel free to continue to finish doing that up as we transition to the next part. So I'm going to turn it over to Dr. Carter to provide everyone some background about the CCCT.
Thank you, Liz, and thank you, Caitlin. I'm going to be relatively quick here because I couldn't find a plug for my computer, so it'll die before the end of the hour. I know, so we're gonna make sure that I'm here until at least noon. But anyway, I just want to give you a brief history of the CCCT, tell you why it's so important, and talk a little bit about its function. And then I will hand it off so that we can get even more information. So the reason the CCT was created was because we had a drive. When we first came to the health department back in 2012, what we realized is that we needed to take care of our population and improve our overall population health in our county. And there were many studies being done, RAND study, then the University of Maryland was doing the study. And it all pointed to several things, but one thing it was clear is that we have a lot of people who have needs, and those needs weren't being met adequately. Even though we had relatively good infrastructure in terms of hospital systems. We didn't have enough FQHCs. Our partners didn't know each other really, and we sort of were in all of our little silos. So the goal was to create a way to manage the population's health. So we created a population health management effort in Prince George's County. And that sort of culminated in us getting a grant called the Health Enterprise Zone Grant, where we could concentrate on one specific zip code, that was 20743, and see if we could improve the health of that community as well as decrease the overall healthcare cost. And that's actually the driver for all population health. It's the quality of care that people get, their quality of their health, their overall health care, lifestyle, etc., which all goes into improving health with respect to how much it costs. And so one thing we realized is that we needed to put in place a way of thinking about this. And in order to think about this, in order to manage a population, you have to do the same thing you do when you're a doctor and you're managing a single individual. You have to gather information, you have to make a diagnosis, and then you got to come up with a treatment plan. Well, when you're doing a whole population, what you have to do is you have to do a community needs assessment. You have to stratify their risks so you'll know what risks your patient, which is a population, has. Then you have to come up with a treatment plan for helping those people who have all these risk indicators, high risk indicators, to improve their health. And one of the populations that stood out to us when you do the risk assessment are patients who end up in the emergency room and overutilizing the emergency room because they clearly are reaching out for help. A lot of them didn't have primary care doctors, and they were victims, that I could see, of their social determinants. So what we did was in the Health Enterprise Zone was to create a population health model, and it had to have three fundamental elements. One is it had to be governed. Number two, it had to have partnerships. And number three, it had to have health information technology infrastructure. So the governance of our population health management, which is basically how we're going to treat the population at risk, and in that time it was mostly people coming out of emergency room, was to form the CCCT. The CCCT was the way we were going to govern how our population health management efforts were rolling out. Number two, the CCCT also helped us with that other phase, where it helped us with our partnerships. It brought everybody in the room and we could communicate. And it also helped us with understanding what kind of technology systems we needed, because as people communicated, you started to understand how you needed to do referrals, what kind of information people needed when they saw the client versus when they left the emergency room. And so you can see the CCCT, and then you had to govern it. So you see the CCCT actually played a major role in how we actually did population health management. And it did it so well that when we looked at our data, we actually did improve the healthcare of the population we were focused on, and we lowered the cost because we kept people out of the emergency room instead of using the emergency room 3 or 4 times in a 6-month period. After our intervention, they would either use it one or not at all for a certain select. And some patients we did lose, other ones stayed in our system for a long time. But overall, we saw an improvement. And that, in large part, was because we had a CCCT. What the CCCT does, our medicine for population actually comes from doing care coordination, making sure that people who have needs, those needs are met. So our interventions the bedrock of our interventions were care coordination teams, which involved community health workers. And our community health workers turned out to be one of the most valuable medicines, prescriptions that I could write. What they did was they would get in the community, they would identify the needs, and then help us link people to those resources so that all of a sudden the folks didn't need to use the emergency room quite so much. So the care coordination team actually is the bread and butter for us, for our whole population health management. And because they are the bread and butter, we know that we need to have a group that oversees them and that can enhance them. Now, there's a lot to that, and I could talk about this for a long time. I'm not, because that's what these meetings are for. We're going to break it up. We're going to understand how all this works, and then we're going to enhance our care teams. We're going to enhance our community health workers. We're going to help enhance our partners who receive a referral. We're going to enhance our partners who need to make a referral, like the people who are in the emergency room who need to refer a patient out. We're going to enhance our FQHCs, which are the bedrock of our care coordination, of our clinical care for our patients in our communities, as well as our private doctors. So we have a lot of work to do in terms of shoring all this up and making sure it's in a structure. But that is the overall effort here of the CCCT. And it's, we were talking about what I would like to see in my life. This is one of the things, before I die, I'm going to make sure happens in Prince George's County. This entity, our care coordination team, is going to be the advocates for improving healthcare and lowering costs in our Prince George's County healthcare system. You all are the backbone. You have the strength. The reason we put it in the Health Action Coalition is because the Health Action Coalition actually enhances every aspect of what the CCCT can advocate for and do for our community. You can go to the next slide. So just to say, the CCCT involves everybody: the police department, fire EMS, social services, family services, all of our community-based organizations, all of our health, our clinical care entities, all of our behavioral health, everybody, because it requires all of those people coordinating in order to really help somebody. And our community health workers know that better than anybody else. So that is the goal of the CCCT. I put a big burden on you all. But we're going to take it in small chunks, and we're going to meet the challenge of actually addressing population health in Prince George's County. So with that, I'm going to hand it back off, I think, to Liz now, I believe.
Dr. Carter, would you mind just going over quickly where the prior CCCT left off?
Yeah. So when the last thing we did with the CCCT was, and of course the pandemic hit, so that put us that sort of really froze the CCCT, and we were really looking at homelessness and how we could help improve making sure that people who experienced homelessness, especially if they hit the emergency room or hit the care system, were able to connect to the resources that they could have or help create resources that they didn't have. And we were looking at the flow, the workflow of how the care coordination of individuals who are experiencing homelessness, how we could help them, and each of the buckets that was required to for their referrals. And we had worked out actually a workflow, and this we're going to bring that back up and put this in front of the new CCCT. But that's where we were. That's where we left the CCCT off.
Thank you. And then I'm going to turn it over to Kim to talk about why this work continues to be important and the outcomes of the latest CHOP.
Thanks, Liz, and thank you, Dr. Carter. So as Dr. Carter mentioned, the CCCT is now housed within the Healthcare Action Coalition, and everything we do within the Healthcare Action Coalition is based on the community health assessment. So I'm going to put a link to our 2022 community health assessment in the chat. So you all can review as you have time, but to give a quick overview of how the CCCT fits into this, into the priorities of the community health assessment, social determinants of health was identified as one of our top priorities in the latest community health assessment. And social determinants of health, as everyone on this call knows, drive many of our health disparities and were further exacerbated during the pandemic. And most of the data in the chart may not even fully reflect the effect of the pandemic because it's captured throughout 2020 and 2021. So we've seen that poverty, food insecurity, access to healthy food, affordable housing, inadequate financial resources, access to care, and a disparate built environment resulted in poorer health outcomes. And approximately 12.6% of children live in poverty in Prince George's County. We also saw growth in the county, which while benefiting some may harm others. So affordable housing was noted as a concern in the 2019 CHA and received even more focus in 2022. The median renter income in the county is estimated to be able to afford $1,460 for rent, but a 2-bedroom apartment is estimated to cost about $1,700. The county experienced substantial growth over the last decade, gaining more than 100,000 residents. And this has contributed to many of the social determinants of health issues with not enough housing, need for transportation, and need for more resources to address social determinants. We also saw that access to healthcare is still a leading issue in the county. Many residents lack health insurance. Some may not have enrolled, others are still not eligible. And this is disproportionately affects our Hispanic residents. Those with health insurance struggle to afford health care and prescriptions, and then may have difficulty accessing care due to transportation challenges. We do have the County Health Assures program, which helps to provide health care for those without insurance or sufficient resources. And it's recognized as a positive step by both the community experts and key informants, but it's noted that more of this type of resource is needed. We also have the lack of ability to access healthcare providers. So there's limited transportation options available, and the supply does not meet the need. About 9% of county households do not have a vehicle. And then the distribution of providers is uneven in the county. So some areas have a high geographic concentration of providers, while others have very few or no providers available nearby. And then lastly, the disparities in the health outcomes are complicated. So for example, we saw that Black non-Hispanic residents are more likely to be screened for cancer. However, they still have higher cancer mortality rates. The infant mortality rate for Black non-Hispanic residents is significantly higher compared to other race and ethnic groups. And it's challenging to determine how elements such as stress, culture, structural racism, and implicit bias contribute to health disparities, along with social determinants of health, healthcare access, and healthcare utilization. Lastly, as Hispanic residents now comprise of 1 out of every 5 county residents, but healthcare access remains a substantial challenge. So when we, and then Liz, you can go to the next slide. When we look specifically at our resident provider ratios, and this is from countyhealthrankings.org, we have fewer primary care providers, dentists, and mental health providers per resident than the state. So some of our key findings and recommendations include increased care coordination resources and more funding and resources for health and support services. And I will pass it back over to Liz, who's going to provide some qualitative information from the field.
So just continuing on our thought process of why this work continues to be important and why we wanted to relaunch, I'm just going to share some stories from community health workers in the field about the barriers, so we can really come to the table to kind of problem solve. So the first story I'll read out loud to the group. While I enjoy being able to provide support for my fellow Prince George County residents, I am often faced with a huge barrier. The lack of resources available in the county, specifically rental and housing assistance, has become an issue. Oops, sorry, I went too far. Persistent issue. The clients and I are often left hopeless, and the residents are less willing to work with us. These programs, which they're referring to programs through the health department that involve community health workers, are aimed towards bettering the health of all clients, but we cannot focus on that if they have some other more persistent necessities to tend to. And these stress factors and lack of resource may result in poor health. As community health workers, our job is to connect to community resources, but we cannot unless there are resources available. And just the last story of the field, just to get a great sense of what it's like to be on the front lines. I have seen many cases of women and children in risk of being evicted and are only given housing if they spend some time at a shelter. For example, one of my clients is a young pregnant woman who lost her job and has been sent an eviction notice. I tried to look for resources, but the housing department said the list was closed and there was nothing they could do. I looked for various charities, but they were all out of funds. I was unable to help her and she was evicted. Not only is this an extremely unfortunate situation for her children, for her and her children, but it also took an emotional toll on me because I felt as though I failed at helping her. So I just wanted to give you all our perspective from what it's like from the qualitative side and the quantitative side of why this work continues to be crucial for our county. And I'm going to hand it back over to Dr. Carter to talk about the direction that the CCCT wants to go to.
Thank you, Liz. So just sharing with you all, and you can read it here, what our vision and our mission are. And I sort of stated it before, and you can hear it in the statistics and you can feel it in your bones, that what we have to do, we need to get our entire population healthier, and especially those who are vulnerable. So our mission is to make lives healthier, and to do that in an efficient way by coordinating their care with a system that is strategic and that is efficient and that we can measure and see how well we're doing so we can constantly improve. So we're taking a systems approach. That's all in our mission. And our vision, of course, is so that Prince George's County, every last individual has access to care, has access to high quality care, and we are effective at helping them manage our system so that they can be sure that they get the health care that they deserve, that's tailored to them and meets their specific needs. Now, that's why every last person on this particular call and every last person who joined the CCC, that's what they feel in their hearts. One thing we know is that we can do this, but we can't do it alone. You have to coordinate, you have to partner. And the CCCT is the venue for doing just that. So that's how we're going to solve the problem. It's going to be us collectively. It's going to be through the leadership of the health department. And it's going to be through you all actively making sure that we meet our mission and vision. So I think that with that, I'm going to just hand that back over to you, Liz, because I think that's what I wanted to convey.
Yes, so again, just to reiterate what Dr. Carter said, we are looking for support for you all into meeting these mission and visions. And today the goal was just to reintroduce individuals who are not aware of CCT and kind of review where we left off, why it's important, and where we want to go. So that is actually the entire agenda for today, just an introduction to our plan. So we hope you all felt inspired and that our juices are going and thinking of ways how we can all work collectively to solve these problems. We hope that you join us for our next meeting, which will be right now. We are having them the fourth Thursday of the month from 11 a.m. to 12 p.m. And they will continue to be in a virtual setting. So that is the end of today's meeting. Caitlin, did you have, and Kim, any last words before we log off?
No,
Yeah, I did a very good job.
Oh, thank you, Tracy. Of course,
Yeah, this is very touching. This was very needed. This is on point. We need to have more of these sessions. I enjoyed it, Liz. You did a wonderful job the way you did it, facilitated, honey. You're going to do it. Thank you. This is nice. Very much needed.
Oh, I'm glad. I'm glad.
Well, the only thing I want to conclude with is that, as Caitlin said, we're going to give you all homework. So, I mean, you might not be so happy with us because we're going to roll up our sleeves. And the next meeting, as Caitlin said, is going to be a working meeting. We're going to start working through workflows and talk about and find out what the needs are from people as you all see it. We got to get your perspective. You're going to need to know that all of the perspectives, and we're going to put it together. So this is systems building. I know we left off at one point, but we got to start sort of relaunch. So it's going to be some homework, and you'll see Kim send you a whole bunch of stuff and Liz. And so anyway, thank you all for coming. I really appreciate it, and hope to see you all in October.
Nice meeting you, Dr. Carter.
Nice meeting all of you all. Thank you so much.
Thank you all so much.
Thank
Oh,
you
I
very
see
much.
Dolores, I see your hand is up.
Yes, I have one question. Now, okay, I'm glad that we did have that meeting because I do know now. I know one of my questions was asked. I was asking myself, what was the health department doing behind this? The research that we are been working towards, and some of the things that we are encountering with every day in the communities. Now, the homework that you guys will be implementing on us is this going to be questionnaires about something that we are doing or something that we feel might be needed in the community to help you guys
it's going to be both. So what we're going to do is we got to start doing an assessment. So we got to find out a lot of it. We got to get a lot of information on the table. And so, no, we're going to be finding out what you're doing and what you think should be done. Those are all of that is very important.
So let me give you an example of like one thing we did in the past so you kind of understand the type of thing we might do. So we did that survey today where we got your information and where you might be most useful or your organization might be most useful. In the past, also one time we did an assessment on homelessness, and we really wanted, I think, for example, we all know that there's housing issues right now that are huge for people, and there's not enough resources to meet them. And so that's kind of a talking point that a lot of leadership uses, housing is a real issue right now. But we wanted to understand, like, okay, but what does that really look like? Like for you, Dolores, when you're doing your work, where exactly are you encountering the problem? Like, are you able to help people who are currently homeless, but you're not able to help people who are 5 months behind in rent? Are you able to, what is the actual issue, and where could an investment be made of money or resources that it would actually have a tangible impact on the problem? So providing that kind of information is much more effective when we're trying to advocate for additional resources, because we're like, put, $30,000 into emergency rental assistance and you will help these people. We know this, right? Because we asked everybody who's on the ground and we got the information of where exactly the investment is needed. That's just one example, but I think we're trying to collect that type of information for every problem that we're seeing so that we know as a system, all right, these are our priorities. These are the things that need to be addressed. And we have things like Jay sharing in the chat, maybe there's some resources that we haven't fully, known about as a group. So there's also that kind of informal information sharing that's occurring also. So it's not, we're saying homework to kind of be cute, but we're not really going to make you write a paper or anything. We just want to know, collect systemically.
Okay.
What's
Well, I
going on.
totally understand where you are going to and why you are needing the information. But one thing I did have a problem with is that when we express our needs and what things, obstacles that we are running into in the community, when we get ready to find those resources, I mean, there are plenty of resources for people that have children. But when it comes down to senior living, a lifestyle, or senior healthiness, or not so much as the homelessness, but we have a lot of problem with people that don't have kids, that are that do have those that do have kids that do not know how to go by to communicate with the medical care and stuff like that. So when we reach out for those resources, we don't get a response. We don't get a response, and we don't have the direction where to send them to. So therefore, I understand when people are saying they make it seem like we are not doing our job, but we do not have the resources, and the resources we do have are not working. So I'm glad that this meeting occurred. So now I understand that you guys are listening to us, and maybe we could start making some type of adjustment and put the money in the right location.
Absolutely. That's exactly the type of information we want to collect.
Oh, okay.
And work together on.
I hope I ain't sounding mean anything, but
Not
this is
at
where
all.
I'm expressing my job.
That's the
and
way.
what I'm
That's the way
doing.
these meetings should go.
That's what this is.
And so
yeah.
when
That's exactly
so in the community, there's a lot of things going on, and we just got to have the resources so that we can, do our job correctly and to build that trust. Because if you taking the information and then nothing is occurring, you lose that trust. You lose that rapport with people, and we don't want to lose that because our jobs are important to us.
Absolutely. That's this.
Okay.
This is exactly
I'm
what this group
Dolores
is
with
for.
the big mouth. I'm Dolores with the big mouth. Okay. So.
Well, you're in the right place because that's exactly what this group is for.
And
I agree. Yes.
Well said. Well
Dolores
said,
for office.
Dolores.
Thank you. Thank you.
All right. Well, thank you so much, everyone. I promise next time we'll have a little bit more open discussion. Our icebreaker took up a lot of time, but I'm glad we broke the ice. We're all friends now. And next week we can really get down to, or next month we can really get down to business and have discussions and stuff. So thank you all so much for your time today. I'm excited to re-energize this group, and we'll see you in 1 month.
Yeah.
Thank you so much. Great.
Bye, everyone.
Bye, everyone.
Launch today will be a Pedro's.
Thank you.
Bye.